Welcome, everyone. See some folks are still connecting to audio, so we'll give them a moment here. Great, and it looks like everyone is here. So welcome. We're really excited that you're able to join us today. My name is Michael Walker, and I'm the Director of Admissions, Student Services, and Financial Aid. And we're really excited because we have the opportunity to present the Master in Cardiovascular Science program here at Emory. We have a really special guest joining us today, and he is the highlight of the day, Dr. Eric McNair. He serves as the academic director for the program, has been here since its inception. And we'll get the opportunity to be able to hear from him today. But I do want to say a quick, huge welcome to every single student who's here today. A few housekeeping pieces. We are going to ask that you do keep yourself muted during the presentation. That will allow Dr. McNair to be heard by everyone on the call. There will be an opportunity at the end of the presentation for a question and answer period. And so at that time, feel free to utilize the chat, or if you want to come off of mute and ask your question at that time, we'll be happy to speak with you and be able to answer your questions. And I do want to thank folks right off the bat for being on camera. It's really nice to be able to start connecting names and faces. And so if you're in a place where you can, we do encourage you to bring yourself on camera if you can. But with that, I'm going to turn it over to Dr. McNair.
Thank you, Michael. I appreciate your warm welcome. And I'd like to welcome all of the prospective students who are thinking about coming to Emory for Perfusion School. As Michael has said, I am the program director for our newly launched program. And I would like to give you a brief presentation. I'll just share my screen here. All right. So our program that we're offering here, as Mr. Walker said, is a master's in cardiovascular perfusion science. And it is housed at the School of Nursing here at Emory University. And we have just launched our inaugural class this fall. Now, what does a perfusionist do? A perfusionist is a clinician that works in the operating room or the intensive care units and other areas of the hospital where needed. And the perfusionist operates very highly technical equipment, often used for the temporary replacement of the heart and or lung functions. So we operate heart-lung machines, extracorporeal membrane oxygenation devices, also called ECMO. We operate heart assist devices, intra-aortic balloon pumps for counterpulsation, also ventricular assist devices, blood transfusion devices, and many more highly technical equipment that is utilized to either keep the patient alive during cardiac surgery or offer life support in intensive care unit settings. So what are some of the characteristics of perfusionists? A perfusionist has to have a high degree of education and also a high degree of skill and dexterity A perfusionist also needs a high amount of critical judgment. The perfusionist is often in situations that could be tense or stressed. So perfusionists need to take that educational information that they've learned and process that into clinical judgment and have the ability to deal with various clinical scenarios that might take place with care of critically ill patients. So why should one pursue a master's degree in perfusion science? Perfusion has a growing demand for their services and new programs and existing programs. Some of the stats that I can give you is that there's been a 22% job growth rate for perfusionists over the past 10 years. The average age of perfusionists is about 40 years old and 40 years and older. So many of the perfusionists will be retiring soon. So we need lots of new perfusionists to move into the field. The American Board of Cardiovascular Perfusion, which is our educational society that will provide the certification for perfusionists, they have reported that 38% of active perfusionists will retire within the next 5 years. Annually, there's almost 1 million cardiac surgery cases performed, with about 350,000 of them being for coronary artery bypass grafting for those patients who have coronary artery disease and suffer from, say, for instance, a heart attack, those patients that have dysfunction of their heart. There's also an expansion in our field to support transplantation, cardiac assist devices, and also with the COVID-19 crisis that occurred, the pandemic, we found that perfusionists were highly utilized in our ability to provide ECMO to these patients. Many of these patients that wound up in the intensive care unit were on our devices, our ECMO devices. So with COVID-19 and the H1N1 crisis and various respiratory illnesses that have come to the forefront of the medical community, the perfusionists are the ones that are able to help keep these patients alive so that they can be treated and so that they can go through their healing process. So the demand for perfusionists has skyrocketed. So let's talk specifically about our course of study. Our course of study is a 21-month program. It is a on-site, full-time program. It consists of 22 courses that are worth 65.5 credit hours, 750 hours in lecture and seminar, 4 clinical practicum courses with 960 clinical hours, 195 hours of simulated experiences, and we have interprofessional training with the various other programs, such as the CRNA program, and we have interaction with the medical students as well. I want to give you a little background on our inaugural class to give you an idea of some of the demographics that of our class. We have about 60% of the students were out of state, with about 40% in state, representing states such as Alabama, Florida, Georgia, Louisiana, Michigan, and North Carolina, to name a few. 60% of our class was female, 40% male. The average age is 29. with a range between 20 and 40, and the average GPA was 3.4. So various universities represented from across the country, Michigan State, LSU, University of Cincinnati, NC State, Oakland University, to name a few. And the undergraduate majors that are represented in our inaugural class, those students came from a biochemistry background, a biology background, kinesiology, nursing, respiratory therapy. So in our inaugural class, we had multiple students with biology majors and nursing students. These students, many of them had prior roles as anesthesia techs or cardiovascular technicians. Some were ECMO specialists, monitoring support technicians, registered nurses. We had a couple that were into research assistants, and respiratory therapists. Now we have a state-of-the-art simulation area that has various equipment that's associated with us. I'm wondering, do we have Brian in on our call?
Yep, I'm right here.
I'd like to introduce you to Brian White, who is the Assistant Director of the program, and he will give us a little information on things that are taking place at our state-of-the-art simulation center.
So thank you again for everybody being here. The Simulation Center, and it gets me excited just to talk about this sort of thing. The Simulation Center is absolute state-of-the-art, and you've heard that a million times from people that talk about their simulation programs and things like that. But what goes beyond just simply calling it state-of-the-art is what we're actually able to accomplish now that we have this set up and running. And the type of simulation we're going to perform, because Emory already has this established for the nursing school, by simply modifying and adding the equipment that's important for perfusion, is going to be unlike any other place in the country. And in my opinion, I think we're among the top, if not very soon, the top perfusion simulation center in the country. This center is going to be achieving official national recognition as a center for healthcare simulation. And then on top of that, we will be submitting for, of course, high fidelity certification through the American Board of Cardiovascular, which will be an easy feat to accomplish considering the technology that we have. But what makes me excited is some of the things we've been able to acquire and put into use for high fidelity simulation. Not only are we going to be able to replicate some of the features of what you will feel in the operating room, but we actually are doing this in a full-fledged, fully appointed simulation operating room. I mean, everything that you would see, to the lights, to the bed, to the actual physicality of the operating room, the feeling of being in an OR is going to be replicated all the way down to a really cool, and this is the new fun toy that I like playing with, really cool cardiovascular dummy that has a full beating heart that's able to be cannulated and placed on bypass through the use of technology, through the use of computer-driven simulation that will simulate as you go on and off bypass as the perfusion student, what would occur, and we're able to manipulate what happens and test you and challenge you with some of those variables. But it's exciting, and I think that's going to be one of the most advanced developed programs in the nation. And in my opinion, and Dr. McNair's opinion, the most advanced. So we're excited. I think you guys should be excited, and I look forward to seeing everybody's application. That's for sure.
Absolutely. Thank you, Brian. As he mentioned, we're very excited about our new simulator that will not only use for teaching, but we'll use it for evaluation, and you will feel like you are in the OR. So that was our vision, and that's our thrust to give you that clinical background and simulation before you actually get to the OR and start working on patients. So we're very excited about that. We'll talk about the Emory Healthcare network and the background with the Emory Healthcare network, and some of the types of cases that you'll see. So we have, within our region, we have complicated valve replacements, high-risk coronary artery bypass graft surgeries, robotic surgeries, high-level aortic cases, including type A and type B dissections that have been referred from hospitals within the state of Georgia and the Southeast. You'll also have the ability to work with and train in our pediatric hospitals, which also do adults with congenital heart disease. You'll also be exposed to heart and lung transplantation cases. As I said before, ECMO and temporary and implantable ventricular devices and supportive care as a bridge to transplantation, as well as counterpulsation devices like intra-aortic balloon pumps. The Emory Healthcare system has a national reputation with heart and lung transplants. And we have the renowned surgeon, Dr. Mani Dineshman, who is also the medical advisor for our perfusion program. Now, the clinical sites that we currently have affiliation with are, as I said, Emory Healthcare, which consists of Emory University Hospital, Emory Midtown, Emory St. Joseph's. We also have Children's Hospital of Atlanta, Piedmont Hospital, Navicent Hospital, Wellstar Kennestone Hospital, as well as Tanner Hospital. We are also expanding our affiliation agreements, but we have solid hospitals already that we have established our affiliation agreements with, and these will be the sites for the rotation of our students. Now, when we talk about prerequisites for the program, we have a prerequisite under the physical sciences category. So general biology with the lab, anatomy and physiology 1 and 2 with the labs, which is a 8 semester hour minimum, chemistry 2 courses, organic and inorganic with the lab, microbiology and physics, microbiology with the lab and physics with the lab. Prerequisites for math include introductory statistics and college math, either algebra or calculus. Medical terminology is required for those applicants who don't have a healthcare background. We prefer that our students have a healthcare background, but we have taken into the program new graduates, new college graduates. So with those new college graduates, we would prefer that you have a medical terminology course. Now, with that being said, not all prerequisites are created equal. So there may be a request for pre-approval of the prerequisite courses. And some of the things that you may have to do is produce the course syllabus so that our admissions team can have a look at it to see if those courses have the adequate course description, objectives, and credit hours to align with the prerequisites that we require. You may have to submit a request for approval to the Office of Enrollment and Student Affairs. And our admissions team can talk with you a little more about that if you have specific questions about your prerequisite courses. Now, another note about the prerequisites is that you can apply for the program before completing all of your prerequisites. If you're short on your prerequisites at this point and you're taking the class this fall, or you plan to take it in the spring, you can apply. And you let us know the classes that that you're taking to fulfill that prerequisite, and we'll have your application. We'll look through your application, knowing that you have these classes to fulfill. But you need to finish all of your prerequisites prior to orientation and the start of the new school year. Now, admission requirements continued. The students should hold, or the applicants should hold, a BS or BA degree in a science or health-related discipline from an accredited university or college. The applicants should have a cumulative GPA of at least 3.0 on a 4.0 scale, with a science GPA of 3.0. As I said before, completion of all prerequisite courses and shadowing experiences are highly recommended, and the students will, or the applicants will, undergo an interview. Now, let's talk about shadowing. Shadowing is highly recommended, and shadowing is where the students go into the operating room and sit beside a perfusionist and see exactly what we're doing. It is highly recommended that you shadow so that you know what you're getting into. It would be a very shocking experience for you to come into the OR for the first time and not know exactly what perfusionists do. So we highly recommend shadowing, and it also shows your motivation and enthusiasm about becoming a perfusionist when you put forth the effort to have a shadowing experience. Now, there's some things that you need to know about shadowing. You need to contact the hospital, contact specifically the chief perfusionist, and let him or her know that you're interested in the field and you would like to watch them or shadow them as they're doing a case. So things you need to know entering the healthcare system as an outsider. There's certain things that you may be asked to do, such as fulfill vaccine requirements, health requirements, background checks, drug screening, etc. So it depends upon the hospital where you want to shadow at. But I want you to remember that there's certain criteria that have to be fulfilled for one to enter into the healthcare system and shadow a perfusionist. Unfortunately, we don't have the capacity to assist applicants with their shadowing, so it's going to be up to the applicants to set up their own shadowing experiences within their city or area hospitals that are in their area that are performing cardiac surgery. Let's talk about the interview. The interview process is a holistic experience where we're assessing the students on their background and how they present themselves in the interview. So it's a very, very good process where we get a feel for the applicants and kind of ask them a few questions and determine their mindset and motivation for entering into the field. We would prefer that our candidates have at least 1 year of clinical experience, such as a nurse in a critical care environment, ICU, CCU, the emergency department or operating room, or physician assistant, respiratory therapist, ECMO specialist, cardiac rehab physiologist, CV techs or CV technologists, perfusion assistants. So any of those clinical backgrounds would give you a very strong application to the program. For the fall of 2024, we aim to enroll 15 to 20 students. We estimate by year 5, we'll have 25 students per year. And we aim to increase our enrollment based upon our clinical site availability and our capacity. Speaking of tuition, I would like to hand it over to Michael so that he could talk about the costs associated with the program.
Sure. And so these rates that you're currently seeing listed up here are for this year, which would be 2023 to 2024. Later in the fall, our new tuition rates will be decided upon from the larger Emory University and posted on our website. But we did want to give you a sense of what the cost was. And so this program is $1,625 per credit hour. There's also a $600 per semester simulation lab technology fee. Students who apply to this program, they are eligible, through the submission of a FAFSA. They're eligible for any federal aid that is available. At present, this program does not provide internal scholarship funding opportunities. All of you are looking very early at the program. And so I do encourage students that are looking for scholarship funding, being able to conduct an external scholarship search would be very helpful. But we do offer financial aid. And so there are federal grants and loans that could be leveraged throughout the process. All right, and I'll turn this back over to Dr. McNair.
Thank you. Now, it always comes up, how much does a perfusionist make? And so we have some stats for you that I've pulled off of the American Society of Extracorporeal Technology website, and it varies between geographic regions how much a perfusionist makes. So the perfusionist also varies with the level of education. So we're offering a master's degree here. Some programs still offer a Bachelorate of Science, but we're offering a master's. So it depends upon the years of education, the skill set, years of experience in the field, and of course, geographic region. So the average perfusionist annual salary is about $150,000 a year. Range anywhere between $133,000 or $134,000 up to $162,000. I was looking on the website last night, and I saw that in California there was a high perfusion salary of about $230,000 per year. Now I want to speak about our accreditation status. This is a twofold path for new programs as far as the accreditation, with university accreditation being the first path, and second path is accreditation through our CV, our national CV perfusion program. So we have already achieved our university accreditation through our association, the Southern Association of Colleges and Schools, also known as SACS. And we are working on the second arm of the accreditation process, which is through the Committee on Accreditation of the Commission of Accreditation of Allied Health Education Programs, also called CAHAP. So we have submitted our initial candidacy status application, which has been approved, and we are moving into the second stage of accreditation. Actually, we have had a virtual site visit, and we are moving forward with our accreditation, and we anticipate full accreditation before the first graduating class. So Emory is a very well-known university with various programs, and we have our professors and professionals that are experts in accreditation that here at the university that have been working with us in the program, and we we don't have any hesitation in thinking that we won't achieve full accreditation before our inaugural class graduates. So we are well on our way. So when students graduate from our program, they will be awarded a master's in cardiovascular perfusion science. They will be eligible to take the national exam, which is the board exam. So this is with the American Board of Cardiovascular Perfusion, also called the ABCP. So once you graduate from our program, you will be eligible to take the board exam and become a certified clinical perfusionist upon passing the board exam. Now, many states have licensure. Say, for instance, in the state of Georgia, you have to have a license to practice perfusion. But once you pass the certification exam, that allows you to apply for a license within a specific region. So the question is, will you be one of the students or one of the 4,750 certified perfusionists nationwide? Are you willing to, and do you have the impetus and the motivation to take on the challenge of going to perfusion school and keeping the pursuit of the perfusion degree and becoming one of us? Thank you for your time, and we will open up the floor for questions. Turn it back over to you, Mr. Walker.
Sure. And, again, we appreciate each and every one of you coming today. You can either come off of mute and ask your question, or please feel free to utilize the chat. And actually, I see we do have our first question here from Abigail in the chat. And then I do see a mail as well. So he'll go next. But so Dr. McNair, where can we turn in proof of our shadowing experience? And actually, I can answer that. During your application process, there will be a section where you can upload supporting materials. And so some of the ways that I've seen the shadowing experience or proof of shadowing experience provided is either there is a form that the healthcare system that you did the shadowing experience at, they would have some kind of log that you could go ahead and share a copy of that with us. I've also seen students just include it on their resume. And so those are the two most common ways in which I've seen that experience be shared. I don't know if Dr. McNair, if you have a preference or maybe another way that experience could be shared.
That's absolutely correct, Mr. Walker. Most hospitals have a form that the perfusionist will provide to the students. The form will be filled out, which includes the perfusionist, the surgeon, the type of surgery that was performed, the hours or how long the bypass time took, and any particular things that the student noticed. You could jot that in the comments section, things that stood out to you, questions you asked the perfusionist, or questions that might have popped up into your mind after the case. You could jot those things down. You could look up some of the things that you didn't understand during the surgery. So there are forms that are available to the students at the sites, or you can create your own and have some of the particulars lined up on there that I just mentioned, and have the perfusionist sign it. If the surgeon is available, he can sign it as well. So shadowing is very important. Good question.
Awesome. So I guess next on my screen here, I see Emil McGee. Feel free to come off mute.
Hello, everybody. Thank you, Dr. McNair, Mr. Walker, and Mr. White for holding this information sessions. Really helped. I've been a RT for about 8 years now, and I just actually submitted my application about 3 weeks ago, just waiting for it to be reviewed. I have a total of 5 questions, but I'll ask them. I won't bombard you guys all with all 5 questions right away. My first question is, are the perfusion professors at Emory, are they faculty or are they active perfusionists who are like adjunct professors?
Both. Myself and Brian, we're professors at the university. So we are perfusionists. I've been a perfusionist for 34 years. Brian has a number of years as a perfusionist. So we are faculty at Emory. We have 2 more faculty as well that are perfusionists, and they are running our simulation at the Emory Nursing Learning Center. So we have perfusionists that are faculty, and we have faculty from the School of Nursing. So we have nursing faculty that will help us with some of the courses in particular. We also have some MDs that are helping to teach the course. They're faculty at the university. Dr. Powell is, she's an intensivist, ICU doc. She's teaching our pathophysiology course. And we've got a couple of other docs that are MDs that are participating in teaching as well. So we've got perfusionists that are professors that have advanced level degrees. Then we've got nursing faculty that are PhDs, and we have MDs that are teaching as well. So we've got a wide range of professionals that are providing teaching and clinical experience or clinical expertise rather for our perfusion students. So I hope that answered number 1.
Yes, it did. Thank you very much. I'm going to leave my hand up because I have a few more questions. Thank you.
Okay,
Awesome.
You're welcome.
So we have Mac and then Logan.
I believe Logan was actually ahead of me if he wants to go ahead.
Oh, okay. There you go.
You mentioned the credit hours and everything. What would you recommend in regards to working while you're in the program?
We do not recommend that students work while they're in the program. This is a full-time in-person program, and it's going to be very difficult for a student to work. As perfusionists, we work very long and odd hours. We don't work the typical 9 to 5 job. So as a student, if you're in your rotation and you're working with a perfusionist, say for instance, the case might start it might be an afternoon case. It starts at 1 p.m. So you would stay until likely the case is over. You wouldn't just be able to pick up and leave at a specific time to try and go to another job to work. So we expect full dedication from our students. It's a 21-month program, so we're in hopes that the students will be able to dedicate that time to gaining knowledge and experience with the perfusion program. So working is not recommended. Thank you for the question.
Awesome.
Matt?
And you can go ahead, Matt.
Yeah, I was just curious. I believe it's the ENLC, the pictures of the simulation lab. Most of those looked like they were rendering, so I was just curious how much of it is actually physically present and in fruition now, and how much of it is coming in the future.
So it's here. It's live. Are you in the state?
Yes, sir. I'm in Athens at UGA.
All right. Well, if you want to come up for a tour, we'd be happy to give you a tour. I guess you could just you could work it out with Dr. Walker, with Mr. Walker, the logistics, and we'd be happy to give you a short tour. I don't have Brian. Do you have any pictures of the
So
operating room?
I was just gonna mention, actually, there is I forget the exact email, the exact web address, but I believe it's nursing.emory.edu. If you go to that website, there's a direct link to the Emory Nurse Learning Center with actual live photography of the entire learning space. It's amazing, and they're still in the process. It's great that you bring that up. It is an older building, and I don't remember the exact year that it was developed, but it's 8 stories. It's a tower that Emory has essentially leased space in, and they're in the process of taking over every single floor. Right now, we have, I believe, it's either 3 or 4 active floors that Emory has developed that's fully renovated and taken over, and eventually there are plans to take over every floor for different purposes. But Perfusion will get their own space in entirety for that as well. But right now we share the simulation space, which is an entire terrace level, kind of a basement level, that's been fully redesigned. And I kid you not, when you're on this level, you feel like you're within a hospital. There's a section for ICU, a section for floor nursing care, and then an operating suite. It's really amazing what they've been able to do with this.
All right. Can you say that website again, Brian?
Sure.
Please.
Nursing.emory.edu.
Thank
All
you
right.
so much.
Okay. Thank you, Brian.
Great. And we do have a couple of questions here in the chat. The first one is from Sean Matthew. For the pre-approval of prerequisite form, where can we find the forms? And so actually, so we don't have a pre-approval form. What you would simply do is just email nursingquestions@emory.edu. And again, that's nursingquestions@emory.edu. And just, if we would encourage you to include the syllabus whenever possible. It just makes it a lot easier. And also if you have the unofficial transcript handy, that would be helpful as well. But you would just simply email that to us and a member of our team would evaluate it and then get back to you. And I'll be sure to actually add that email address in the chat before we leave. And I do see there was a second part to the question. When do we find out what class that we need if we submitted all the academic transcripts and are uncertain on what classes we need to take? And I'll actually turn that over to Dr. McNair and Mr. White.
Okay. All right. Hang on one second. This is about the prerequisite classes? Sorry.
Yes. Yeah, so basically, once we've evaluated the application and we see that there are a few classes maybe that they need to take, when would we alert them about that?
Yes. So once the applications have been received by the admissions office, and the admissions office will go through those applications and compile the missing data, the missing courses. Then we will notify the students within a couple of weeks that they're missing specific classes, and then it's up to the students to enroll in the classes. Sometimes you can find a biology or chemistry class. If you're missing a class, you can find it online, and you could take it at your own leisure. So we will notify you as soon as we can if there's anything missing or anything untoward in your application, and we'll get back to you and let you know what you are missing, and you can start working on getting those prerequisites done.
Wonderful. And then I have a question, one other question here in the chat, and then we'll go to LaDeja after that. So this is from Caroline. She says, you know, October 6th, is the October 6th date listed on the website the date those in the current application cycle will find out if they're selected for the next step of the application cycle? And so it looks like she's asking about, you know, for the interview selection, which would be the next phase after the application review, when would those students be alerted?
I'll let you take that one, Michael.
Yeah, so I will share that there. So we have 3 rounds that are listed on the application itself. Those dates are in flux because this is a newer program, and so what we do is we take a look at a critical mass of the applications. We see who are the students that we think could be a good fit, and then we start to alert those students about with an interview invitation. And I forget, when did we target the interviews for this year, Dr. McNair?
We're going to have the interviews in January or February of 2024. So we'll look at the applications. Once the admissions office has deemed that those students have the GPA, have their prerequisites, and the shadowing experience, then those students will be called for an interview. We'll have the interviews. There'll be rolling interviews. So as students' applications have been approved by admissions for the interview committee to look at, then we'll set up an interview for those students. And we had a rolling process last year. So we had 3 or 4 different rounds of interviews. So we don't want to have all of the interviews at one set time. So as the applications come in, we'll start setting up interviews in 2024, early 2024.
And I will share,
sorry, go
that
ahead.
sounds great. Well, and just so you know, we have started the review process, which will take a couple of months. So please be patient with us, as you know, it is a very popular program and lots of wonderful applicants like yourself are applying. So we do ask for your patience during the review process. So we do have LaDeja who had a question. Please feel free to come off of mute and ask your question.
Hi, good afternoon. Thank you guys for hosting this session. It's been very helpful. My question was, I was wondering if you were able to disclose the amount of applications that you received for your last cycle.
Yeah, so for the inaugural cycle, we had, I believe it was around 50 to 60 applications that came in, and we had 10 students who started with that inaugural class. I could tell you, just looking at the volume this year, we were almost at that volume at this point in the cycle. And so the word is getting out about the program. And we're really excited about, you know, folks like yourself who've decided to throw their hat in the ring and show us how they could be a great fit for the program.
Thank you so much.
Oh, you're welcome. Great. And Amel, we're going to come back to you. And then I know there's a question in the chat from Abigail. We'll answer that next.
Thank you. This next question is twofold. One, how many cases does the average student graduate with? I know that we have to sit at the pump, I believe, for at least 75 cases in order to sit for the boards. I was wondering, as students, are we able to exceed that? And then secondly, twofold question, are the clinical simulations that you guys were talking about, does that apply to the cases that we sit for, or is that a totally separate thing?
Good question. As you said, the requirement for the American board is 75 cases. So that's the minimum amount of cases that you need to achieve in order to sit for the board exam. We expect that that students will have more than 75 cases. We've got I think Emory Healthcare does about 1,400 cases. Let's see, Brian, can you help me out with the numbers there? I know Emory does about 1,400 cases. So we got St. Joe's and Piedmont.
I can tell you, just off the top of my head, numbers aside from all these places, I know Piedmont does very high volume. I think they're between 1,500 and 1,800 a year. But just for an example, I worked prior to starting with this program. I was at Wellstar Kennestone Hospital as a perfusionist there for a number of years. We had regular rotational sites there from Midwestern University, and obviously now it's switched to Emory University. But the students that would come through on their rotations would regularly pump 2 surgeries a day. The surgeons at that particular site are very quick. So you can imagine, put on, a couple of months there, you're going to be performing at that rotation alone, 30, 40, maybe even more cases just on that rotation alone. So the capacity for you guys, your entirety of rotations, I mean, I certainly can't guarantee numbers, but you will be well above 75 cases. I can promise that. Yeah.
And the other part, thank you, Brian. The other part of that case question related to simulated cases. So the simulated cases will not count towards your 75 cases. Those cases are getting you ready to move into the clinical rotation. So we're providing you with simulated scenarios that will be before, during, and after cardiopulmonary bypass, and different scenarios that you will encounter while you're on pump at your clinical rotation site, so that hopefully you've seen and you're able to react to some of the things that you will see at the clinical sites. So we're in the simulation. We're trying to get you ready for a real life situation. So that's what simulation is all about: teaching and evaluating you before you go out to the clinical sites.
Thank you very much.
Awesome.
You're welcome.
And we did have a question here in the chat, really just asking for advice on the best way to prepare for the interview so that applicants can be successful.
All right.
So Dr. Aaron or Mr. White, did you have any advice for these students?
Well, one thing that I would say is get a good night's sleep so that you're chipper, you're ready to go. Be confident in your in the background that you have. Be able to respond to the questions about your background. You should be able to not go into a lot of depth, but you should be able to respond to questions about your background and your background knowledge. So, and then another thing that we'll be asking you about is, when you did your shadowing, what did you see? What did you experience? What did you notice about the perfusionists? I would say that you should be ready to go for a full session of questions about you and your background and your clinical experience, if you have any, and your shadowing experience that you've done. Anything to add to that, Brian?
Sure. More than anything, just remember, obviously, as daunting as this process can be and nerve-wracking, it doesn't have to be. We're not here to trick you. We're not here to try to make things more difficult for you. What we really want to know is, because perfusion is such a unique career, it's off the beaten path. First of all, what drew you to it? And second of all, why? Why do you feel like this is a field that you want to enter? when compared to the number of other advanced practitioner fields that kind of fit this mold as well. And it's always interesting to hear reactions from prospective applicants to that question. So think about what kind of unique response you could give to that.
Absolutely. What can you bring to the field? Thank you.
Awesome. And I know we have about 5 minutes left here. I know, Amel, we may not get through all of your questions, but if you had maybe pick your top remaining question, that would be awesome.
Thank you guys for allowing me to ask so many questions. My last question, when I was doing my shadowing, I believe they worked with the Stockart S5, but they were talking about the bypass machine and I believe it's called the Spectrum, which is new. I was just wondering at Emory, which heart lung bypass do we gain experience with?
Good question. We have the S5, and we just purchased a state-of-the-art LivaNova Essence heart lung machine. So we've got a brand new machine that will teach you how to run, and we have a S5 like the one that you mentioned. We don't have the Spectrum Medical, but if basically what we want to do is we want to teach you how to operate a heart lung machine that has a centrifugal pump and a roller pump for the arterial head. So there's many different heart lung machines out on the market. So we don't have all of the different heart lung machines. It would be impractical for any perfusion program to have all of the different types of heart lung machines. But we have state-of-the-art Essence, and the key, as I said, is learning to run the different types of arterial heads, which would be the centrifugal pump or the roller head pump. And we're teaching our students to operate those two aspects of the heart lung machines that are out on the market. So by the time you finish, you should be able to go into any institution and operate their heart lung machine, no matter what company it's made by. Good question.
Thank you very much. Appreciate it.
You're welcome.
So you may have questions that come up after this presentation. Please don't hesitate to reach out to us. I did put my contact email in the chat, so please feel free to reach out. We're happy to help in any way that we can. And if there was a question about whether or not a copy of the recording would go out. And so, yes, in a few days, we will email this out to everyone on the call and those who RSVP'd but didn't have the opportunity to join us. But thank you so much, Mr. White, Dr. McNair. Any parting words for these future applicants?
Brian, if you'd like to go first.
Sure. First of all, thank you for just actually having the emphasis and the interest in joining a session like this, just to kind of listen to what we have to say about it. And second of all, take every possible opportunity you can to try to shadow, to watch things. Go down the rabbit hole on YouTube, watch every video you can. Are all of them going to be super accurate pieces of information? Not necessarily, but they will open up your eyes to things that go on. There are actually cardiac surgeons that have channels on YouTube that specifically talk about different procedures, and you'll see a lot of things relating to perfusion with that. So, gather all that information, everything you can, and it, will help you, if nothing else, make up your mind further as to whether this can be a career that you may really like. Other than that, put in the application, and hopefully we'll see you guys soon.
All right. And in closing, I would like to thank all of you for coming in to listen to our informational session. And we encourage you to apply. It's a very specialized field, and we hope that you will want to be a part of our specialty. Thank you very much, and I look forward to looking over your applications.
Thank you, everyone.
All right. Bye-bye.